So when dealing with shoulder pain, we commonly find that many people have tightness or a sore spot in the back of the shoulder. Oftentimes, some tightness in that posterior deltoid or something like in the lat junction right here will sometimes also cause this humeral bone, this arm bone, to really be pushed forward in space. So one of the ways we can effectively treat that is to just kind of reduce some of the tone back there. One of my favorite ways to do that is a self-assessment or myofascial release type of technique. You're basically doing a massage for yourself. You can take a foam roller. So what I typically do is I will reach my arm out, and you're just gonna scan. When I scan, I'm looking for any tender spots, any tight spots that feel pretty good. As you get closer to that shoulder joint, you might get a little bit more tender and sore. So I'm really looking for this spot right behind the arm bone, right on that shoulder blade, in that junction, just before the armpit really comes in. So I'll kind of get in here and I will just roll up and down. If your butt is off the ground, there's going to be a lot more pressure in that area. If your butt is down, you can just kind of go and feel for it. You can roll and find that segment. I just hit it. Doesn't feel great, but it feels good when you do work on it. So I'm just gonna hang out here for a minute or two. Just, you can kind of pin it and move the arm. You could pin it and just kind of roll back and forth, or you could just kind of roll around it or roll directly on it. Okay, I usually don't want people to have more than like a 5 or 6 out of 10 discomfort when they're doing any type of foam rolling or self-massage. I don't think that's the purpose of it. I think it's just for you to feel good. But if you do have any shoulder pain down the front or down the side, this might be a good way to try decreasing some of the tone in the back of the shoulder. Give it a try.